Hey everybody, this is Stacy with Spectrum the Other Clinic. I'm going to teach you how to do an intramuscular injection today, hopefully. So, you'll notice that I'm wearing gloves. That is just so that you can see my hands a little bit easier when I'm doing stuff here. All you need to do is wash good with soap and water for about 20 seconds prior to doing this, okay? Cool beans. So I'm going to move the camera down here so you can see all my little supplies. This is going to be you. So this is going to represent maybe your thigh or wherever we're sticking, okay? It's my little fake piece of skin. This is my needle and syringe. My needle is a safety needle. It's not really got a very pointed top so that hopefully I won't stick myself. Haha. And then we've got our medication here that I'm playing with. You may or may not have a top on your medication whenever you get it, but we're going to pretend like you did. So then I've got my little alcohol wipe here, which I've opened up because I've run this bit about 17 times now and haven't gotten it right since. Woo! Hopefully this is a charm. So anyway, so we've got your site that you've picked out, we've got your needle and syringe put together, and we've got your medication and your alcohol wipe. We're good to go, right? Okay, cool beans. So you're going to open up your little alcohol wipe, or you can get a cotton ball and some rubbing alcohol. You're going to wipe in a circular fashion for about 10 seconds to sterilize the site. Also, if you don't have a cap, or if you flip the cap off and something touches the top, whatever, and from subsequent times, anytime you access this with a needle, you're going to need to cleanse the top. It's just good practice anyway. Circular motion, about 10 seconds, and I mean really scrub that sucker. The last thing you want is for a little piece of bacteria to get in here and find a home and then, you know, reproduce. No thanks. I'm going to put my little alcohol wipe off to the side because you never know when it might be useful again. Now then, I've got my site cleansed, I've got my vial cleansed. The next thing for me to do is to take my needle and syringe and pull up the amount of air that is going to be in my dose, which is going to be 0.5 milliliters for our purposes right now and make it a little easier for you to see. So we're going to pull up the amount of air that is your dose, and we're going to put that air into the vial when we're going to take the medication out. So this is because there's a vacuum in this vial, and if you just keep pulling out, you're going to really screw up the vacuum in there, and eventually it might spray out or leak or something like that. So good practice is air in, liquid out. All right, so we've got our 0.5 milliliters of air. We're going to get this on a nice firm surface, okay? Pull the top off, set it aside. We've got this on a firm surface holding it. We're going to just stick the tip of the needle right on through that little plunger. And we're going to flip this upside down. Let me see if I can turn it so you can see it better. We're going to squirt that air up into there. Make sure that your needle tip is below the line of the medication. This is just water for our purposes. And make sure that it's below the line. I know that sounds silly, but I'll have a lot of people who have it up here and they're wondering why they're pulling air out. So make sure it's below. I'm only going to pull air back out because I've made a horrible mess with all this water previously. So let's pretend like I'm pulling the liquid. You're probably going to have some little bubbles here or whatever. You can try and squirt them back out and pull back out. It's fine. Bubbles are not going to hurt you. These little tiny bubbles, whenever you inject them into yourself, are just going to dissipate. Like, it doesn't do anything. It's fine. So anyway, we've got our 0.5 milliliters pulled out. So we're going to set this back down and pull it straight out. Now we're done with the vial, and I'm going to set that aside, and we're ready to inject. Now when you inject, you're going to stick down about 1 inch to 1.25 inches deep, depending on your body size, but 1 inch usually does it. This needle is a 1.25 inch length needle, and you're going to go in at a 90-degree angle, which, just to kind of show this, so that would be at this type of an angle, okay? 90 degrees. And you're going to use what is a dart motion like this, like you're throwing darts, honestly. Boop, really quick. There's no need to just slowly stick it down. That is just not the way to do it. You'll psych yourself out. No way. So, dart-like motion, just get it done. It's fine. You're not going to stab too deep. Like I said, if you have 1 inch to 1.25 inch needle, it's going to stop whenever it hits the hub. You're fine. So anyway, you're going to take either your thumb and forefinger, your thumb and middle finger. I'm a middle finger type person. And you're going to either give a little pinch here, or you're going to flatten the skin out, whatever's more comfortable. I'm a pincher. So I get my little pinch, and I'm planning on sticking right in here, 90-degree angle, down about 1 inch, and a dart-like motion. So, boop, just like that. So you can see 90-degree angle, and this was 1.25 inch long needle, so I've got about 1/4 inch poking out. That's perfectly fine, as long as I went down 1 inch. So now, you're sitting here, you're going to release this hand grab the very bottom of the syringe here, release here, and then go up and slowly inject the medication. Boop. When you're done, you can either grab a hold of here to stabilize and pull out, or you can just pull out. Is perfectly fine. You might want to grab your little alcohol pad or a cotton swab or something like that and hold over the site for 1 to 2 minutes in case you have some bleeding. Bleeding is perfectly normal. You may get a little, you may get a lot, you may get none. It's kind of the luck of the draw. Every now and then you're going to hit a big capillary, it's going to bleed a lot. Every now and then you'll just nick a really tiny one, you might have some clear liquid come out. It's all fine. But once you're done, you can remove that. And as far as disposing of your needle, you can either throw it into your container like this, or if you're like many who like to recap, just don't recap by holding your cap. Make sure you do the fishing technique, which is where you take this and you kind of fish the tip of the needle into it so that then you can flip it up and then click it on and dispose of it. Ta-da! Anyway, now we're going to walk through it a little bit quicker. So just follow along. Let's get all of our supplies. We're not going to have the cap on it this time because this is a repeat injection. So we've chosen our site, we've got our medicine, we've got our needle and syringe, and we've got our little alcohol pad. We've washed our hands with soap and water. Take the alcohol pad, circular motion, cleansing, 10 seconds. Vial, circular motion, cleansing, 10 seconds. Okay. Now, drawing up 0.5 of air, which is equal to our dose. Good deal. Taking off our cap, firm surface, insert, flip, inject the air, and then make sure the tip is below the liquid, and draw back your medication, which would be 0.5. Flip, pull out. Now we're ready. We can set this to the side. Grasp, 90-degree, dart-like motion. Anyway, grasp the bottom, inject slowly. Once you're done, pull out. If you need to, apply a cotton ball or a alcohol pad here in case there's any bleeding. If there's not, you're good to go. Set that to the side and then either throw this in your container or, like I said, do the fish technique and kind of fish it on there. Good deal. Alrighty, I have a whole separate video for things that you can commonly see that occur with injections, such as swelling and things like that, as well as injection site leakage. Check those out if you need to. Otherwise, rewatch this as many times as you need to get this down pat. It is not rocket science. Anybody can do it. Hope this helped everybody. Bye!